My name is Ebony Younger,
And I'm Aisha Dunn.
and today we will be presenting information on mastering therapeutic communication. The objectives for the class today: the student will define therapeutic communication, name 3 therapeutic communication techniques, define non-therapeutic communication, name 3 non-therapeutic communication barriers, and give 2 explanations of the benefits of therapeutic communication. So, what is therapeutic communication? It is a process in which the nurse consciously influences a patient or helps the patient to a better understanding through verbal or nonverbal communication. Therapeutic communication involves the use of specific strategies that encourage the patient to express feelings and ideas that convey acceptance and respect. Mosby's Medical Dictionary, 2009. So, therapeutic communication techniques. The first therapeutic communication techniques is to ask open-ended questions. You avoid yes and no questions to allow the patient time to elaborate and actively participate in the communication process. You give broad openings for the patient, actively listen, use silence as a therapeutic technique to allow the patient to continue, and you also use clarification.
Non-therapeutic communication. What is non-therapeutic communication? Non-therapeutic communication interferes with the nurse-patient relationship by putting barriers in the way of open, trusting, and a respectful dialogue. Non-therapeutic barriers. Underloading, which is remaining silent and unresponsive, not picking up cues, and failing to give feedback. The patient asks the nurse, and she simply walks away. Incongruence, sending verbal and nonverbal messages that contradict one another. False reassurance, using cliches to reassure the client it's going to be okay. Changing the subject. Once a patient is talking to you, you never want to change the subject while they're speaking mid-sentence. Giving advice is also a barrier. Never give your patient your own personal opinion or tell a patient what you would and wouldn't do. Challenging is simply testing one's ability. Defending, such as the patient doesn't like their doctor or they didn't totally agree with the night shift nurse. You defend the doctor and say statements like, well, you have the best doctor around, or you should be grateful for him as your primary doctor. The last one is focusing on self. Do not respond in a way that focuses attention to the nurse instead of the client. This sunshine is good for my roses. I have such a beautiful garden. Other ineffective barriers. Facial expressions. Examples such as turning your nose up in the air, frowning, laughing inappropriately, laughing nervously, having a closed posture, such as if your patient is talking and you're standing there with your arms folded across your chest, tapping your foot. This is signaling to the patient that you do not want to be bothered and that you have somewhere else to be. Also, never look too busy for your patient. If they're talking, take the time to relax and give them some of your attention. No matter if all of your call lights are going off, give them the time that they need. Never make sarcastic remarks. Uses of therapeutic communication. You can use therapeutic communication to build a positive nurse-patient relationship. You can also use it to encourage further communication among colleagues and patients. And lastly, you can also use it when giving reports, such as during shift change. And SBAR stands for Situation, Background, Assessment, and Recommendation. And now we will play an interactive video. Now we will play an interactive video for the students to demonstrate non-therapeutic communication techniques, positive and negative. And we're asking that the students pay really close attention to the video because there is a quiz following to see if you were paying close attention. Stay tuned. Say what you need to say. 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 Say what you need to say.
Hello, I'm Julie, and I'm going to utilize a teaching strategy, role play, to demonstrate therapeutic and non-therapeutic communication. But first of all, what is therapeutic communication? It's a type of communication that we utilize with our patients to establish a good rapport with them. There's two main components involved in therapeutic communication. First of all, you have your interacting skills, and you have listening skills. A few things I want to point out about the interacting skills that you may or may not see in the video. First of all, does the nurse convey interest? I want you to think about that throughout the two videos. Does she show interest in her patient? Does she demonstrate respect of her patient? Is she available for assistance, and does she protect her patient? The second part, as I mentioned, to therapeutic communication is your listening skills. So some things I want you to monitor for in the videos would be nonverbal communication. Do you notice any positive or negative aspects of her nonverbal communication with her patient? Does she listen attentively or objectively to her patient? Does she interrupt? And the last thing, is she using eye contact with the patient? Is she using appropriate body language with the patient? So during the videos, I would like for you to think about those things and see if you can identify any of those components of therapeutic communication. Ms. Smith, did you call?
Yeah, I'm really hurting. Is there any way I can have pain medicine?
Yeah, can you just give me a few minutes? I've got a couple of patients down the hall that are really whiny today, and I'm just really busy right now, so it'll have to wait, but I'll be back in just a little bit, okay?
Okay, I hope it doesn't get any worse.
Yeah, me too. I'll be back. Ms. Smith, I have your pain medicine here.
Okay, great.
Okay. Hold on. Let me check your armband before you take that. Okay, state your name and date of birth for me.
Kim Smith, 3/11/78.
Okay, all right. Well, I'll come back in just a little bit and check on you, all right?
Okay.
Go ahead and take that for me. I can't
Okay.
leave the room till you take it.
Thank you.
Okay, I'll be back. Ms. Smith, did you call again?
Yes. Can you help me up to the bedside commode?
Yeah, but first of all, I need to find out what is your pain like now? Is it any better than it was?
It's about a 3.
A 3 now? Okay,
It's a little better.
all right.
You know what? I haven't seen Dr. Smith today. Is there any way that you can come see me, or
Dr.
have you seen
Smith?
him?
Oh, Dr. Smith, he's something else. He hardly ever comes around to see his patients. If I were you, I would have gone to Dr. Jacobs, but I'll take a look for Dr. Smith when I go out there. I doubt he's here, though.
Oh, well, I really have some questions about my diagnosis, and I'm kind of upset that no one's come in to talk to me about
Really?
what's going on.
Okay, well, did you need to get up to the bedside commode?
Well, you seem like you're really rushed, so I won't go. I'll just wait. That's fine.
No, let's go. Let's get up if you need to go. Have like 5 minutes.
Okay, well, I'm kind of shaky because I just took that medicine.
Okay, well, I'll stand right here.
Can you help me?
Now, what can you do? Because I don't want to pull my back out if you can stand up on your own. I don't want to pull on you. So can you do anything on your own?
I'll try.
Okay.
I'll try.
Wait. You're about to pull your IV out. You don't want to pull that out because I would have to stick you again. Okay, go ahead and get up now.
It's okay. I'll just wait.
You don't need to go?
No, I'll just wait. It's no
Okay.
big deal.
All right, just call me if you need anything then.
Okay.
Say what you need to say. Say what you need to say.
Hi, Miss Smith.
Hi.
My name's Julie. I'm your nurse today. Did you need something?
Yeah, I'm hurting really bad. Can I have pain medicine?
Sure. What was your pain level at right now? Remember that 0 to 10 pain scale? What is your pain level at?
It's like an 8.
An 8. Okay,
Yeah.
yes, you do have something ordered, so let me step out and check the orders and grab your pain medicine. Let me do a quick pain assessment. This is where we would do the pain assessment. Okay, I'll be right back with your pain medicine, okay?
Okay, thank you.
Did you need anything else while I'm out of the room?
No, I'm good, thanks.
Okay, I'll be right back.
Come in.
Okay, Mrs. Smith, I have your pain medicine here. And you said your pain's at a level 8, correct?
Yes.
Okay, well, let me put this right here. And before you take that, let me check your name and date of birth. And can you state it for me?
Yes, it's Kim Smith, 31178.
Okay, good thing. All right, you can go ahead and take your medicine. All right, now that's Vicodin, so it may make you a little bit dizzy. Don't get up without my assistance. Push the call light if you need me for anything, okay?
Okay.
I'll be back in about 20 minutes or so to check on you.
Okay, thank you.
Okay. Miss Smith,
Hi.
did you call again?
Yes. Is there any way you can help me up to the bedside commode?
Sure thing, but first of all, what is your pain like now? Is it any better?
It's about a 3.
It's down to a 3 now?
Yeah,
Much
it's feeling
better.
better.
Much better. Okay.
Have you seen Dr. Smith today?
Dr. Smith, not that I recall. I can call his office and see what time he's going to come around today. Do you have some questions?
Yeah, no one ever really talked to me about my diagnosis, and I'm kind of upset because I have a lot of questions that no one has answered, and,
Okay.
I'm a single parent, and I don't know how long I'm going to be in here. Basically, I don't know my prognosis. I don't know how long I'm going to have to be here.
Okay.
And I just have things at home that I need to take care of, and no one's really explained anything to me.
Okay. Well, those would be good questions for Dr. Smith. So let me see if I can contact him and let him know that you would like to speak with him.
Okay.
In the meantime, did you still need to get up to the bedside
Yes,
commode?
please.
Okay. Be real careful there. I know you might need to sit on the edge of the bed for just a few seconds before you get up.
I'm still a
Oh,
little
hold on
shaky.
1 second there. Your IV's caught up on that side rail. I'd hate for that to come out on you.
Oh, me too.
Okay, so just be really careful when you get up.
Thank you for being so patient and
Oh.
helpful today.
You're welcome. No
I
problem.
appreciate
No
that.
problem at all. Okay. So now that you've seen the 2 videos, I would just like for you to think about how you would have felt in the patient's shoes in the first video compared to the second video. I think you would agree with me that we would all prefer to have a nurse more like the one in the second video than the first. I always think about safety, especially in that first video. The patient probably would have been less likely to call for the nurse when getting out of the bed the next time she needed to get up, since the nurse portrayed an attitude of not wanting to be very helpful. Whereas in the second video, the nurse was very helping and did not seem to mind being of assistance to the patient. So I think, the risk for falls probably would have been less, just to name one advantage of therapeutic communication in this scenario. So just always keep in mind the components of therapeutic communication and those interaction skills along with your listening skills.
Take all of your wasted